The Brugada algorithm is for differentiation. Is this ventricular tachycardia or just supraventricular tachycardia with aberrancy, like a bundle branch block? Follow these 4 steps in order. If answer is yes to any step, the diagnosis is ventricular tachycardia. Step 1. Absence of RS complex in all precordial leads V1 to V6. That is concordance. If all leads are entirely positive, only R wave, or entirely negative QS complexes, it is ventricular tachycardia. Either positive concordance or negative concordance in precordial leads is suggestive of ventricular tachycardia. Measure the start of the R wave to the deepest part or nadir of the S wave. The distance between these two, that is the horizontal, if it is more than 100 milliseconds, it is suggestive of ventricular tachycardia. Look for P waves marching independently through the QRS. That is a feature of atrioventricular dissociation, almost a sure pattern of ventricular tachycardia. But this is going to be difficult in a fast ventricular tachycardia. In the illustration, it is a slow tachycardia, or rather accelerated idioventricular rhythm, where it is easier to see. And hallmarks are fusion beats and capture beats. Fusion beat is one in which part of the QRS is contributed by sinus beat and part by the ventricular beat. So the morphology will be intermediate between a sinus beat and a ventricular beat. QRS width will be narrower than that of a ventricular beat, but broader than that of a sinus beat. Capture beat is fully sinus capture. It is just like a sinus beat, normal PR interval and narrow QRS. Both are seen in this strip, but this is not ventricular tachycardia, a variety known as accelerated idioventricular rhythm, sometimes also called as slow VT, which is typically seen in reperfusion after a myocardial infarction. Then there are several morphology criteria for ventricular tachycardia, which is rather complex. The classic VT shape is left rabbit ear taller than right in V1. On the contrary, if it is left is smaller, that is shown in the picture, it is SVT with aberrancy. That is the typical RSR prime pattern in right bundle branch block type of aberrancy. This is easy to make out and memorize as well.